Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health?
Hi, everyone. Dr. Adriana Popescu here with you once again with Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I'm very happy to have with me as my guest Mitsuko Ito. She is a licensed massage therapist and a certified trainer in TTT tapping, EFT tapping, and havening techniques, and a frequent workshop presenter on college campuses. Mitsuko's work bridges traditional Eastern wisdom with modern insights into emotion and psychology, focusing on simple, practical strategies that anyone can use. And we'll get a little sampling of that today as well. The goal is to make powerful neuroregulation tools accessible so people can experience more clarity, connection, and consciousness. Welcome, Mitsuko. So glad to have you.
Thank you. Thank you so much for having me, Adrian. It's really excited.
Yeah, and we've actually crossed paths before. We've been in some trainings together, and we're both part of the energy psychology organization. I think you may even have been in one of my workshops at one point. So it's great to see you. And
Yes,
we want to learn more about you. So tell us a little bit about your story, how you got to be doing this work that you're doing today.
sure. Well, COVID was definitely a big thing that propelled me forward to offering a lot more workshops. So I'm really proud and happy that I'm very supported to delivering the information, the very simple tapping tools and havening tools to many different people. But backtracking a little bit more, I was a massage therapist, as you have mentioned. And I think that that was maybe already 10, 15 years ago. But I was really good at detecting the pain points within other people's body. And part of the reason is because I grew up having chronic pain myself, just having loads of issues, stress and tension in my body. So when I'm working with clients, then I was able to tell where they're storing that stress and tension and having ways to help release it. Later, then I found out that with EFT tapping and such, we can also work with them at the emotional level or approaching from using emotions and energetic entry points to help release that stress and tension. So that really took me into that field more than just staying with the massage. But I do think that massage therapists offer so much. I heard that you were also trained in massage, which is fantastic because they're so, this is like the ultimate embodiment or ultimate, it's so dense. And so if we can feel the stress and tension in here, eh, as if we're able to release from the body, very similarly, we can release from the emotions. I don't know if I'm making sense, but there's definitely an interesting overlap that I find it fascinating.
Yeah, I mean, massage therapy was really my introduction into all things holistic. At the time, we called it alternative medicine or complementary medicine. And it was, yeah, through my own struggles, my own health issues that I was drawn to that. But like most people, I think that who grew up in our more Western culture, I was really disconnected from my body. I was kind of, up in my head all the time growing up and in my young adulthood. And I didn't even really know I had a body. I was so disconnected from it. And massage really, training in massage and receiving all that body work, while you're in
Mm,
school really opened my eyes to like a whole nother world of learning and understanding and how everything is so interconnected. Like I don't know how you separate mind, body, emotions, spirit. To me, it's all energy, right? And energy gets imbalanced, it gets stuck. And these wonderful modalities help shift energy. So I'm curious because when and some massage training programs do include some energy work. I learned some myself in school, but how did you kind of mostly they're focused on the muscles, the fascia, and specific maneuvers, to move that tissue. How did your work with massage start help you to start seeing things more energetically?
Yeah, and you mentioned a really excellent point. The massage school, for me too, it was an eye opener in some ways. These Western folks and the teachers were saying, there's emotion that gets stored in the body, there's stress gets stored in the body, and that was not really a concept that I understood mentally until I received the body work intensely. And it felt great, and it was a lot of aha, oh, is this what they're talking about? They kept on saying, trust yourself, trust what you're feeling, and probably like you, maybe I was too, really disconnected, and that's probably why I was having so much stress and tension just accumulating and having leading to chronic pain all the time. So you're right. Thank you so much for reminding the value of that massage education, the bodywork education. And I'm sorry, I forgot the question that you were asking me, but tell
Well,
me once
we're,
again.
we're trained a little bit more, to focus. And I think most people have this perception that body work in the form of massage is about, muscles. It's about muscles, maybe some tissue as well. Sometimes you hear people talk about fascia. But we're really working with like where muscles are tight, trying to release that tension, right? To get softness, to release knots, right, that people might have in their back and their shoulders, but it's so much more than that. And at some point you became more into attuned to the energetic. So I was curious about how that happened for you.
Hmm. I don't know that it was during the massage school that I had the awareness awakening, so to say. I do remember the teachers were talking about it, and I did feel like, oh, this is really interesting what I get to witness with my colleagues, with my classmates, how they were just making sense of it and just really grasping it quickly. I think for me, it took a while until it wasn't until I opened up my practice, my bodywork practice, and then I started working with clients. I was having a lot of tough cases. There were several cancer patients, and I had actually lost probably 3 clients within the first year of opening my practice too. Lots of pain, lots of issues, physical issues. And but somewhere along the line, I think that working with them, I realized that they're a reflection of me and seeing how much stress that they're holding, how much emotional stagnation that they were holding, I realized that, oh, this is probably what I have been experiencing because as I'm releasing theirs, then they might say things like, "Oh, emotion came up," and or they're feeling so much lighter, or the stress rolled back for many months worth of stress has rolled back, things like that. So it made me really curious to find more about what is it that I'm helping people release, and then came a point when I was also touching the body. There's this dense line that I was feeling that was releasing. When I look up at the meridian charts, then there was definitely an overlap. So I felt like, oh, maybe what I'm tracing is the meridian. And sometimes I would ask the clients, look at this chart. Do you feel like this is what I was following? And they would say, yeah, that's that. And then when you look at the Chinese meridian charts, and they would often talk about how there's a correlation with an emotion or the organs, and just a vast amount of knowledge with my little bit of dabbling into the emotional freedom techniques, talking about the emotions, freeing, and the meridians. I was like, oh, this is really interesting. I wonder what this is all about. So I think that it was through observing others and working with others that I was just slowly piecemealing it together. I can't say I'm an expert in making that connection. I just know that as we do the tapping and havening, and as we invite people to tune into the emotion, there's just a lot of release that can happen really quickly. That's my short abbreviated version of discovery.
So I have two follow-up questions to that. One is why you mentioned that people hold trauma, stress, tension in their body. Why is that? Why do we hold that tension? Because I other animals, I don't see other animals doing that. I pet my cat. He always seems pretty relaxed. I don't see him having like his shoulders up here around his neck. Um, from stress. Like, why human? What are we doing? Why do humans do?
Hmm. Yeah, I don't know that I have an answer to that other than I know that that tends to be true because I grew up like that. I think that a lot of my shoulder pain, headache is a result of me just holding tension and just trying to. And in my own personal case, it was because I needed to stay quiet. I needed to not bother. I wanted to be a good girl, not cause any trouble. And that was just kind of making me stuck like this and being a bookworm, just keeping quiet, my 5th chakra perhaps, and just staying, quiet and small too. There's probably a lot of belief system, but I don't know what the difference is between other animals, like, why don't they? But I would think that animals might have it too, because there can be traumatized dogs that would have
There
behavioral issues.
for sure.
Mhm.
I know people who
Mhm.
work with horses, and I've actually had a little bit of experience with that.
Mm.
And yes, you can sense that there's something going on, but more, I guess I was thinking with animals, it would be more of an injury thing, but they also could be holding emotions and other stress, trauma, and such. So. Um, it's interesting, and I've seen the same thing with folks where I had the impression when I would work on their bodies that it was like a suit of armor. Like the tissue of their body felt so hard and rigid to me that it was as if they had built their body as a suit of armor for shield and
Yeah.
protection. I bet you saw that quite a bit as well.
Mhm, and I think that I was probably one of those too, so a perfect example, my own healing journey, hopefully that gets to help other people too. But yeah, definitely, I think you mentioned fascia too. I don't know how much focus there was on the fascia when I was in massage school, but I think that's a really important key component in our body that is gaining more and more, awareness, and that's a beautiful thing, it's wonderful. The fascia suit, how that can get all tensed up and how we want to work with that myofascia release. And I think that the meridian system is definitely heavily running along the fascia. There's that fascia line that some people talk about, anatomy train, for example. So there's a great gateway into releasing that fascia suit for trying to unwind it. And then emotional freedom techniques as we tap on some of those potent points, which does start sending signals into the fascia through meridians and all that. I think it's just a really, really fascinating field that more people want to know about. And I think that's one of the reason why my workplace, where I get to share a lot of tapping information, people seem to get it. It makes sense and it's new information and people get excited about learning about it. So, yeah, I'm really honored to be part of the whole movement of raising awareness.
Yes. Thank you for that. And because we've been using this term called meridian, and it may be that not everyone in the audience knows what that is. So could you just briefly explain to us the meridian system and where that term comes from?
Yeah, meridian system. It is part of training in traditional Chinese medicine. It is this energetic line that runs through the body, and it has been documented for many thousands of years. Let's see. I actually have this little figure, if
Oh,
you
great.
might have
Yes.
yes, some of this in an acupuncturist office, and you can see all the dots and the lines. So these dots, as we were talking about, we talk about shiatsu earlier? Maybe, uh-huh. If we press on these points, then that is shiatsu that was developed in Japan, or acupuncturists would insert needles into these points, which are landing on all these different meridian points. And so the meridian points, my understanding, now I'm not a scientist, I'm not a researcher, but my own personal feeling is that it sort of work as a semiconductor. It has a direction that it runs, so the electrical flow can work backwards too. And there are some expressions in Japan, for example, "Don't drop your chi," or "His chi is running backwards," things like that. So I think it is a heavily observed phenomenon how the chi has its flow and direction and how fast it's running or how weak it is and or how unhealthy it is. Byoki in Japanese is, um, imbalanced qi or diseased qi, and so they say that all disease, byoki, starts from the illness of the qi. So correcting the qi flow is paramount to getting a healthy body back. Or when the qi flow is not correct, then that leads to the disease, basically. It's all really universally connected, so I find that fascinating. But yes, the meridian is a long documented phenomenon, and I think that there's probably a lot of clinical research that just shows how potent it is to be working with it. I do recall just hearsay, but and there is a link to the studies, a Harvard medical study over 10 years. They have inserted some needles into some of the acupuncture points, and they were able to observe the downregulation of the amygdala, part of the limbic brain, which means that when you're inserting needles into the body, it helps with stress issues. It helps with all sorts of different things, downstream cortisol um, of overflow, for example, or just a sympathetic overdrive, for example. And that's definitely my own personal experience as well when I have received acupuncture.
Mhm. Yes, myself included. Acupuncture is very powerful, but I think the piece people don't know is that we have other ways of stimulating these same points, right? Whether it's shiatsu massage or it's tapping with our own fingers, right, on these acupuncture points. We're still creating a similar effect. We're still sending that electrical signal through the fascia up to the brain, to the amygdala, like you said, and we're calming the nervous system. We're calming that fight, flight, freeze response. So, yeah,
Mhm.
let's talk a little bit about tapping and what would you like our audience to know? There are lots of different forms of tapping. You practice a couple of different ones. We've talked about EFT, emotional freedom techniques, and TFT, thought field therapy, here on the show before.
Hmm.
We haven't really talked about TTT, which is another variation. Maybe share with us a little bit about that.
I would love to. Yes, TTT is trauma tapping technique, and that was developed by the Peaceful Heart Network, Ulf Sandstrom and Gunilla Hamne. I hope I'm saying their name right. But yes, they've been wonderful humanitarian pioneers, just going all over the world to do work. And they have been working with people that have such stress and trauma in their body, including genocide survivor descendants. And so what they've also observed was that people don't necessarily need to be talking about trauma. They don't need to be verbalizing and reconnecting with it at a cognitive level. But still, we could be doing the tapping, we could be providing the sensory input to calm down the body without using the words. And as I was initially trained with EFT tapping, I was more about the setup phrase and repeating the phrase or digging into the subconscious and trying to pull information, having them say things. Um, with COVID, one thing that has happened that made it abundantly clear to me is that if I wanted to work with many different people with different belief systems, we can't be speaking. It just did not feel safe at that time when there was so much division, but everyone was having so much activation in the nervous system. Let's just all tap. And so the TTT trauma tapping technique that they were put out there for many years already, I went back to it. I've heard about it earlier during my EFT training too, but I really got it at that time during COVID that the value, the simplicity, the nonverbal style, just allowing them to tap, allowing people to go through the motion. No need to use words. That's the power of TTT tapping, and I'm a big proponent of that.
Hmm. So, are
Mhm.
you using TTT more as a form of what they might call emotional first aid? Like you're in a state of distress, you're activated, you're feeling anxious or you're shut down, you're in that fight, flight, freeze type response.
Yes, yes, absolutely. Emotional first aid. Absolutely. And I think it's really helpful to also know that Ulf Sandstrom was my havening trainer too. And again, during COVID times, that's when I was exposed or had the privilege to take the training with them as I was studying or revisiting TTT tapping, trying to incorporate that into my tapping workshops. But havening is also another really safe way to address it. One thing that I like him remember him clearly saying in so many different times is that when it comes to doing this type of motion too, he would say that that can help people stop their panic attack before it goes into it. Maybe not so much after it has really started to be full blown, but if you see someone starting to get agitated, then this has a way to really calm down the nervous system to prevent them from going into panic attack, or if you're witnessing someone in shock, like you mentioned, it TT tapping is great too, but also I feel like knowing havening techniques in addition to TTT or even a combination of two, which is eventually what I started really doing, sharing with my workshops. It's a wonderful first aid.
Hmm. Okay,
Mhm.
so we have a general idea of the tapping. We're tapping on different acupuncture points on the body. Tell us more
Yep.
about havening.
Mhm. Havening techniques is a different type of sensory input. Rather than tapping, we are providing soothing touch, gentle, soothing application of, yes, stroking motion mostly. So mostly from the face, we call this face havening. And then if we do it from the shoulder down to the elbow, this is called arm havening. And then again, there's so many neural points on the hand. And so this is called hand havening. Those are three main points because of the potency. Dr. Ron Rudin, Dr. Steve Rudin, they were the founders. They have developed these techniques, did a lot of digging into literature to find that one of the things that they like to mention is that these are some of the most potent points where it seems to induce a higher rate of delta brainwave, which means the brainwave is feeling more, the whole body system is feeling more calmer that way. Basically creating a safe haven within ourselves. Therefore, even when we're stressed, then it quickly shifts our stress state, or it allows us, for those that are working with people, for trauma practitioners, for example, then the trauma practitioners would be able to take their clients or patients into a more relaxed state so that they can actually revisit if needed, if it was safe to do, to revisit those times of trauma so that you get to actually process it. So it's a really powerful, potent additional tool, similar to tapping in effect, but just a little different entry point. Also, the way that they like to put out the explanation. Tapping, I think it's more how it originated. The origin story is more about meridians and yes, tapping into the Eastern culture, traditional medicine. But this one, Dr. Rudin's, they talk more about the neurobiology and try to understand the amygdala depotentiation, how the neural signal just changes that way, if that helps.
Yeah, and I think the end result, and especially for the person who's in in the middle of this intense discomfort, it's they end up feeling calmer. They end up feeling safer. They
Yes,
feel their logical thinking brain can come back online because it tends to go offline when we're in these states, right?
yes.
Amp up fight flight or the shutdown freeze state. So you have combined these two together, and I'm curious if you want to tell us a little bit about that and maybe even guide us through a little bit of practice. And I will ask, since some people just listen to the audio and don't have the video, that anything you're describing, be sure to be describing, put your fingers in this location or whatever it is, right? So that they can get auditory cues.
Got it. I will do my best. Oftentimes I do this with video, assuming that the other person is able to see me. So I'm going to do my best. Edit.
And I
Thank you
can
so
jump
much
in
for
too
that.
if I catch it. Yes.
Yes, that'll be great. That'll be great. Well, so as mentioned earlier, during COVID times, because initially I was talking about EFT tapping and I may not have gone into using words the whole time, but then I did really like introducing or combining tapping with havening, and also liked to also make a point about breathing at the same time. So what I nowadays share across workshops whenever I do this is I like to call it the ABC of self-regulation tapping. A stands for awareness, and breathe stands for breathing, and then C stands for calming the nerves through the sensory inputs such as tapping and havening. So we can combine all of that together, and that way I also tell people, because we want to make it trauma informed. If anyone feels like tapping is too strong of a stimulus for them, then they can drop the tapping. They can just be doing the breathing and awareness exercise, which is mindfulness exercise. Or if someone feels like just having that mindfulness awareness is too strong for them, for their awareness, they just don't want to get there, then they can just do the breathing and tapping. Whatever it is that works for them, pick what's right and safe for them. But I'll go ahead and introduce all of them and take you through the exercise if I may. That'll be wonderful. Okay, great. So initially, I would invite everyone to just start tapping the side of the hand, the pinky side of the hand. This is what we regularly use for EFT tapping, the pinky side of the hand. As we start tapping here, I invite you to run a body scan, an imaginary body scan. Think about a body scan coming from the top of the head, and let that sink through your brain, your shoulders, your arms. Just let it go all the way down the body. And as you do that, the body scan is picking up and sharing with you the information that it is finding. So, what it's finding is where you're holding stress and tension. Letting that body scan inform you where you're holding stress and tension. For some people, it could be the jaw where they might hold stress. For some people, it could be the shoulder, as is often my case. For some people, it could be a pit in the gut. For some people, it could be shaky knees. Different nervous system have different ways of expressing themselves and different habitual stress responses. So just letting that awareness come to you through that help of the body scan, that's the A component. If you'd like, you can let that body scan run up through your legs, into your groin, into your torso, into your upper body, your arms, your shoulders. Once again, your jaw, your eyes, your brain, and you can let it float up. Maybe it scanned the same place going down and going up, or maybe it was different. And you can just observe it, listen to it with curiosity and interest. So, with that, we can say something like this, and you're welcome to say it out loud or just listen to it, repeat it internally or externally. I like to invite, I like to go ahead and say something like this. Even though I'm noticing the stress and tension, I
Even
just choose,
though I'm noticing this stress and tension,
I honor and accept this is what I feel right now.
I honor and accept that this is what I feel right now.
hmm So this is very similar to a set of phrase, but I think the intention is to make it non-personal, to make it something observed, to acknowledge it, but yet not to get so enmeshed with it. So just acknowledging it and honoring that experience too, without judging ourselves for feeling that. Then we're going to go into the different tapping points. So we'll start tapping the top of the head. And then I invite everyone to take a gentle breath in, breathing in calm and pausing at the top. And then a slow, gentle exhale, letting it out, letting it release. We can jump over to the beginning of the eyebrow point and start tapping here. And once again, taking a gentle breath in, breathing in calm, deep into our belly, expanding our ribs and pausing at the top. And slow, gentle exhale. Next, we can glide over our forehead. This is a little bit of face havening, going over to the corner of the eye where we can start tapping. And if you don't like the gliding, if you have makeup and you don't like that, then you can just directly jump over. Also, if you don't like the tapping, then you can just simply place your fingers over it and gently breathe there, whatever works for you. Yes, beautiful. And once again, taking a calming breath in deep into your belly, expanding your lungs and lowering your diaphragm, pausing at the top. And a slow, gentle exhale. Once again, gliding over or hopping over to the top of the cheekbone. As we start tapping or as you just breathe in there. Once again, breathing in calm, pausing at the top. And a slow, gentle exhale, just imagining, seeing the stress unwind and breathing that out along with your breath. A little bit of visualization, a little bit of awareness there. Once again, we can jump over or glide over to the nose point, which is between the upper lip and the nose, the dented area. Once again, breathing in calm, pausing at the top. And a slow, long exhale. And so all these points, for those that are able to see the video, we are tapping on these potent meridian points. Keep on tapping, but this nose point that we're tapping right now, it starts down here and then it goes around the head and it ends right here at the nose point. The next point that we're going to be moving into, the chin point, that starts right here at the groin and it ends right here. These are very potent meridian points. So the Stanford engineer named Gary Craig, who was the founder of EFT, Emotional Freedom Techniques, he found that instead of having to tap on all the different points and even knowing what their effects are, he thought that if we just pick on some of these really potent points, then there's no negative side effect for tapping them. And there's only positive benefits for tapping a lot of these major meridians, oftentimes the beginning of endpoints. That's how he consolidated a protocol, which is what is part of EFT today. And those have been clinically studied. Let's go over to the chest point right here as we continue to tap and breathe. So I invite you to continue to do the breathing in and just exhaling. But if I may also introduce some evidence-based clinical EFT tapping studies, they are showing that there's a big drop of cortisol after 1 hour of tapping. Clinical study shows that it can be 38% to 43%, which is really an astonishing level of drop of cortisol after 1 hour of tapping. So, and even within 15 minutes, college students may have reported 30-some% drop of change of shift in stress responses. And that's what we get to repeatedly witness on the campus as well. So it's a really fun thing to be able to share with people. Yeah. So we're tapping on the chest point right here, and this is the kidney point. Let's go back to the breathing in and pausing at the top. And the exhale. And what we're doing here with the breath is that we're also working with the vagus nerve just by changing the pressure, changing the rhythm of the breath. Then there's some information that the body, the nervous system that runs in the body, the vagus nerve, is able to send up to the nerve, to the brain, saying that, well, actually, it's okay for me to be feeling calmer right now. So that's where these somatic modalities are really, really powerful as a way to initiate the body and body calming induced message to the brain. And just a few more points, if I may stand up really quickly into here. This is not in the evidence-based clinical EFT tapping point, but this is the liver channel, which is good for anger. So it's a good point to cover. And this is spleen, so we can do both of these together.
So could you explain, you're right at the edge of the ribs, right? At the very bottom of the ribs there?
That's right. Yes, almost on the rib. Thank
Okay,
you.
and then your thumb is like reaching
Under the
out
arm.
under the arm.
Mhm.
Okay.
That's right. Yes, thank you, thank you. Yep, we can tap both of those together at the same time. And once again, we can breathe in deeply, just really feeling that expansion, and out. So those are the main points, but I like to also go ahead and introduce the inside of the wrist to the outside of the wrist because, as you can see, there are three major meridians on the inside and three on the outside. So we can give it double whammy or we can give it additional attention as we tap the inside of the wrist to the inside of the wrist. Coming back to the awareness that we had earlier, wherever you were noticing stress or tension, asking your body, trying to connect and getting back ourselves in to, reconnect to the body ourselves. Asking, why do I hold this stress? And is this serving me? What benefits does it have? Those kind of self inquiry questions. And if it is helping us, because not all stress is bad, we just need that and the body out of its wisdom to try to protect us. It may be causing it. It may be giving us extra cortisol that we just have not remember to release. So, whatever the answer is, if it's something that's for your benefit, we can be grateful. If it is not, then maybe if we're open to communicating with our nervous system, our subconscious, our meridian system, our muscles, whatever there is to work with us, that may be open to hearing our voice. Maybe we can say something like, I'm open and willing to let some of this go.
I'm open and willing to letting some of this go.
And then we can tap the back side of the wrist to the back side of the wrist. Yep, flipping the. Let's do that one more time. I'm open and willing to let some of this go.
I'm open and willing to let some of this go.
And with that, then we're going to go into the arm havening, which is just imagining that we stirred up a lot of stress. So guiding it out of our body, saying, come out this way, come out this way. And then we can continue with that swiping down from our shoulders, down our elbows, down our arms, and also pulling on our fingers and releasing as we pull on the nail beds. And the reason why we want to pull on the nail beds is because a lot of times those are, again, the meridian endpoints or beginning points. And so just extra stimulation for the meridians so that it can start flowing in the right way and or releasing the stagnation there. Just letting it out and pulling it, giving it to the trees or the fire or the compost, whatever there is to receive it. And, they can give it back to us as they recycle it. So just letting it go, letting it go. And let's place our hands over our heart. Take gentle breath in, breathing in calm once again. And exhaling as if feel connected and grounded, letting go of whatever no longer serves you. Let's go ahead and do it one more time. Breathing in and breathing out, feeling grateful and grounded. And for those that feel safe doing so, if you'd like to just check in with your body one more time and see if there's any shifts or if what you're feeling at this moment. Sometimes people feel tingling in their fingers. Of course, we've been doing tapping, so that's quite natural, but sometimes they might feel it in their feet, or there might be some before and after changes. I'm just curious to hear what there might be.
Yeah, I mean, for me, thank you so much for that. For me, I definitely feel more calm, more relaxed. I think my breathing got deeper. I was feeling some tension in the jaw and in the shoulders. That feels lighter now. Um, yeah, thank you so much. What would you recommend for like how long, how many rounds to kind of go through that, or period of time to keep repeating through that? Because it seemed like you took us through like one round or cycle of this.
Right. Yes. I would say that however many times, whenever you're feeling stressed, that's a really, really great time to do it because then you can quickly attend to the stress and lower that stress load from your body. So you don't have to keep on accumulating it. It's a wonderful reset. If someone wants to do it as a, daily hygiene, just like we brush our teeth to keep our teeth clean, if we can do the stress hygiene to not have to yeah, keep the stress within our body. Do it in the morning, do it at night, before bedtime, after you wake up. That's a wonderful thing to do. And I'm glad that you mentioned how long or how many cycles. I would say too that wherever you felt like it's working with you, we don't even have to remember the whole protocol. If someone felt like, oh, this really brought up some emotions for me, then that's a good place to keep on doing it. There are so many points on the body, as you can see with this meridian chart or the meridian mannequin. So the body, you can really do it anywhere, anytime, and for as long as you want. I really personally, when I'm driving, this is my go-to point. When there's a car that cuts in front of me, whew, I would just start tapping here and take one deep breath. And that is often enough for my body to realize that, oh, okay, I don't need to be freaking out. I don't need to be yelling, cussing. And so
Right.
just
So you're
that's off.
tapping on that collarbone chest point. Yeah.
Yes, yes, exactly. Right. And some people might feel here with the forehead, they might say that this is giving me some buzzing feeling in the head. Some people might say that, oh, maybe I'll mention this one right here where the torso meets the arm and shoulder. This one is a lung channel, very potent grief point. So this can be a really good point for people to tap. I think there's a lot of unaddressed grief, and this is not also included in the evidence-based clinical EFT study. So I want to mention that one. But wherever it feels good for you, for however long it feels good for you, for whatever, even just once, even just 1 minute, even just 10 seconds, if you can get to it, get to it. There's no right and wrong, right or wrong.
Wonderful. And I understand you work with students at a college. Is that right?
hmm That's not my main paying job. I'm more of an event coordinator type of job, but my my unit, they understand the value, and there have been funding that we have received from the Mental Health Coalition from this institution, which I'm really grateful for. Me, along with my colleagues, we submitted some proposals, and they see the value, and they are encouraging us to reach to the students so we get to do the workshops and bring them the information. And it's really fascinating. Actually, I'll mention this one too. Recently, with one of the Stress Buster event, I brought in another vagus nerve stimulation tool. They call it Pulsetto. Maybe for someone that's really doing the studying the implant version of vagus nerve stimulation, they might call it not the real type, but students were loving it. Um, yeah, and I feel that tapping is also a way. It's sort of an all natural, free, no expense, totally at your fingertips, tools in your hand type of vagus nerve stimulation tool. But we get to test and try, and they have such a good time experiencing it. It's a lot of fun.
And I would think so helpful. I wish I had had something like that in college to deal with, the stress, the anxiety of finals or exams and grades and applying to grad
Absolutely.
schools or interviewing for jobs, all those stressors and
Yeah.
insomnia and just all I can't focus, I'm so distracted. All these techniques are so helpful for such a variety of different issues. That's really what's so
Mhm.
wonderful about them. And like you said, they're free of charge. This is something you can do for yourself anytime, anywhere. And if you don't have privacy, I always say to clients, go in the bathroom, go hide out in the bathroom, go in your car, and do what you can to help calm yourself down, because you can't think straight, you can't learn, you can't communicate clearly if you're in a distressed, fight, flight, freeze type response. So
And you bring up a really good point. I think that's another reason why I like the nonverbal tapping too, because then we can say, well, you can really do this while you're walking, or as you're talking with your friends, you can do this, or you really don't need to have anyone be finding that you're doing the tapping. You can just be squeezing on your fingers as you make a presentation, right? So, yes, there are lots of applications.
yes. Thank you so
Mhm.
much for guiding us in that demo and for all the great explanation. This is very simple. If people want to find out more about this, about you and your work, where should they go?
Yes. Well, one place where people can find me is decaturtmj.com, simply because there was a time when I was focused on TMJ relief, which later I realized that it's often the stress in TMJ comes from the stress in the body, stress from the emotional level. But that is one way that people can find me. We do have a website. Through my workplace called tapping.ece.gatech.edu, and that is really fun. That has a lot of information there as well. If that would be helpful, please feel free to access. Uh, those are the main places, I guess, that I could leave behind right now.
And we'll
Um,
be sure to include those in the show notes so people can easily get that information.
Thank you. Can I just mention one more thing about the Havening training?
Yeah.
Okay, great. Yes. And I also, for anyone who might be interested in learning more about these techniques, I would highly recommend training in EFT tapping or havening, because that's how I was able to help myself. And I'm really privileged to be able to start offering havening training. So if anyone is curious and interested about that, I would, yeah, love to support you on that journey too. Thank you.
Wonderful. Yes. And thank you so much for all that you are doing in the world, for being on the show. Thank you, audience, for tuning in. If you have found this information useful, please do pass it along, share with loved ones, post it somewhere, repost it somewhere, subscribe, rate, review, all the things that help a podcast get out there in the world. Thanks, everyone. Thanks, Mitsuko. We'll see you next time.
Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time.